Hi, everyone. Good afternoon. On behalf of Hep B United, I wanted to thank you for joining today's Hep B Hangout. My name is Kate Morales. I'm the Senior Program Director with the Hepatitis B Foundation and Director of Hep B United. We're really excited to present today's Hangout session on social media strategies to increase awareness about hepatitis B. So before we get started, I wanted to go over some quick housekeeping and let you know how you can participate today. Please note that you are in listen-only mode and will be muted during all of the presentations. And the phone and audio option is available here. And please be sure to enter an audio PIN after joining the webinar. And this is reliable in case you get disconnected on your internet connection. And also feel free to submit questions at any time during the presentation via the question box shown here. And we'll be reviewing them as they come in, and then we'll have a question and answer period after the end of all of the presentations. So just to give you a little bit of a background about Hep B United and Hepatitis B Foundation, we are a co-lead of the Hep B United Coalition, along with the Association of Asian Pacific Community Health Organizations, or APSHO. This coalition was started about 4 years ago. We're a national coalition. We're a coalition of coalitions, which are made up of multi-stakeholders and multi-sectoral stakeholders across the country. And our goal is to address the disparity amongst Asian and Pacific Islanders specifically. We have a three-pronged goal to raise the profile of Hep B and liver cancer as an urgent public health issue nationwide. We're working to increase Hep B testing and vaccination, particularly among those communities at higher risk. And we're working to improve access to care and treatment for individuals living with Hep B in order to prevent liver disease and liver cancer. So part of our Hep B Hangout tonight is to launch a social media campaign called #HepBUnite. How do you unite for Hep B? And I just want to briefly mention this to you before we dive into our session. This is our 2016 social media awareness campaign that leads up to May Hepatitis Awareness Month. So I wanted to get this on your radar and get your thoughts flowing as we move into our social media strategy discussion, things that you may think of to do while you're listening to the different presenters. So the goal of this is we're inviting you to join us in creating a short 6-second Vine video focusing on this theme, how you would unite for hepatitis B. So your message should focus on any statistics or resources that you have and show in the video how you are united, and you can be creative. So I'll save that for now, and then we will go into more contests, the contest, the campaign, the details at the end of all of the presentations. So I'd like to go ahead and introduce our presenters for today. Our first presenter is Amanda Carney. Amanda is the social media lead with the Education Training Communications team with the Division of Viral Hepatitis at the CDC. And then our second speaker will be Thaddeus Fan. And Thaddeus is the Viral Hepatitis Prevention Coordinator with the Hawaii Department of Health. And he's also co-director of Hep Free Hawaii, the coalition in Hawaii that it, partners with Hep United. And finally, last but not least, we'll have Maureen Comiskey. Maureen is the Hepatitis B Foundation's social media guru, and she also does phone consults and outreach for all of our patients and consumers. All right, so with that, I will turn it over to Amanda Carney.
Hi, everyone. I'm going to talk to you today a little bit about using Twitter strategically, and some of the things I'll talk about can definitely be used for other social media platforms, but here at the Division of Viral Hepatitis, we have a Twitter account, so that's where most of my discussion is going to be around. Next slide. Okay, so just to start off, I wanted to broadly talk a little bit about social media in general. So social media, as most of you know, because you probably have some accounts of Facebook, Instagram, Twitter, etc. But social media is an interactive environment where people can create, share, exchange information, ideas in virtual communities or networks. So here at CDC, we really see social media as a great tool because it can help us complement an overall communication strategy. It's never meant to, be the only communication strategy, but definitely a piece of a good strategy. It can also extend the reach and potential impact of our messages. It's an additional vehicle for disseminating valuable information to target audiences. It facilitates interaction and engagement with partners and community of users, and it provides a means to evaluate and monitor communication in real time. Next slide. With this slide, I just wanted to show a little bit about who is online. So this information is from the Pew Research Center's Internet Project, which is a organization that conducts a lot of research, independent research on social media. And so as you can see, of adults online, Facebook is pretty much overwhelmingly the most popular with the highest percentage of adult users. And then kind of followed by the LinkedIn, Pinterest, Instagram. And even though Twitter is kind of has the lowest percent, it's been growing. And we reviewed, looking at which platform to use here at CDC, we decided that instead of doing Facebook, we wanted to do Twitter because we realized that there were actually partners on the space, and we knew that providers and health professionals were there, and we knew that we could use it as a tool to kind of promote our own resources and talk to our target audience. Next slide. So, with that being said, what is Twitter? And I'm sure some of you at least know a little bit about it if you don't have one of your own, but it's an online microblogging and social networking site that provides real-time information, commentary, and descriptions of events. So Twitter, users can post tweets that are 140 characters or less in length, and those tweets display on their profile page and in their followers' feeds. It was once the fastest growing social media platform, and its value is that you can pretty much spread information immediately and reach your target audience in a way that other platforms can't. And also recently, Twitter now can be seen in 35 languages. Next slide. This slide, just briefly, I'm not going to go completely into this, but this is just a look at Twitter users in 2013 and 2014. And as you can see, Twitter's popular among those under 50 and college educated. But you can also see that although there are gaps in racial and ethnic minorities, those gaps are closing now, and the growth is seen most in those aged 65 and older. Next slide. So with this slide, I just really wanted to show you that it's not just consumers updating everyone on what they've eaten for the day or where they've been, but there are also partners and major players in health and viral hepatitis on Twitter. They use Twitter to promote their resources, disseminate information, collaborate with others, and engage with audience. So here you can just see there's government agencies, peer-reviewed journals, and health societies, public health, medical schools, health departments, and our partners, the people on the call and AppShow and others who are engaged with Twitter and using it to reach their target audiences. Next slide. I won't go into much of this with respect for time, but these are just some basics about Twitter. It's a very interactive platform where you can reply and message and engage with other people's tweets and have them engage with yours. But I just want to highlight briefly hashtags. So most of you've probably seen it's the number symbol followed by a keyword or topic. And that's really a way to kind of join a conversation on Twitter. And also you can use a hashtag to search different conversations and topics and see what people are saying around that. I also wanted to highlight a retweet because that's what you hear all the time. And basically all that is forwarding another user's tweet to all of your followers. And then finally, just looking at the URL shortener, it's a really great tool, not just for Twitter, but for other social media platforms, because it actually saves you a lot of space because you're only allotted a certain amount of space in tweets. And so this can shorten your URLs and also provide you with a way to track and monitor them. Next slide. So here I wanted to kind of discuss from CDC's perspective just some of the benefits that you can gain by using Twitter. And most of these aren't just for Twitter. They could be for Facebook or any type of social media platform. So one of the most important benefits we see is just for information dissemination. Twitter is a great tool to disseminate timely and relevant information and content. You can do it right then and there. There's no waiting. It's a really great tool to communicate with your audience immediately. You can also expand the reach of messages and resources by retweeting and people replying, so it's not just your followers that are seeing your message, but also other people's followers. It's also, for us, a really good tool to use to provide up-to-date communication during events and outbreaks. And biggest thing is probably promotion of our resources, publications, media involvement, and special events and activities. Next slide. Another benefit of Twitter is, in essence, the communication and collaboration that it provides. It's a great tool to cultivate communication with partner organizations and collaborate with them on similar topics and events. Through Twitter here at CDC, we've been able to share information and cross-promote our resources with partners, government agencies, and others through activities such as Twitter chats and Twitter views. And a Twitter chat is basically a conversation between your handle, a guest handle, and followers. Oftentimes it's scripted where you have questions for the guests and they pre-script their answers, but you also have to be prepared for others to ask questions and answer them kind of on the fly. A Twitter view is a little bit more controlled environment where you have basically an interview between your handle and a guest handle. A script's written in advance, and you can choose whether or not people can ask questions and engage. Next slide. Here I just wanted to briefly show just kind of the value of a Twitter chat. This is the Twitter chat we did for Liver Cancer Awareness Month. It was co-hosted by NVHR Hepatitis B Foundation and had special guest Dr. Bob Gish. We were just a partner on the chat, but it was a really great way to engage with the audience and spread awareness about liver cancer and its link to viral hepatitis. So as you can see, there were over 1,100 tweets sent during the hour that the chat was conducted. We had over 14 million potential impressions, and 56 different participants were using the liver chat hashtag during the chat. And the table on your right just shows you the top Twitter participants in that chat by their number of followers. So you can see CDC Cancer, who has over 77,000 followers, CDC NPEN, Hepatitis B Foundation. There were a lot of big players in the field of viral hepatitis that were involved. Next slide. Another benefit of Twitter is just the ability to monitor the conversation. Twitter is a great tool to track the broader conversation and even the sentiment surrounding viral hepatitis in real time. Like I mentioned earlier with hashtags, you can use hashtag searches to look and see what people are saying around certain topics. It's also a great way to stay abreast of trends and misinformation regarding hepatitis or any topic. And by monitoring through Twitter, you can respond quickly and correct misinformation in a timely manner, whereas sometimes information on a website may sit there for a while before you even realize that it could be spreading some misinformation. Next slide. So here I just wanted to start talking a little bit about strategy. So first things first, deciding if you want to do Twitter or even a social media platform, Facebook, any type of social media platform. I think the first thing you should think about would be purpose and target audience. So first question to ask is, what are you trying to accomplish? Is Twitter the best way to do it? Is Facebook better? What type of information will you be presenting? Also, who are you trying to reach? Are you trying to reach the general consumer? Are you trying to reach providers or other health organizations? And of those people that you're trying to reach, are they even on the platform? You can do a quick search and see what type of audiences are on Twitter, and if they align with who your target audiences are, then Twitter might be a really great tool for you to reach them. Next slide. Next, really important for us here at CDC, we had to develop a strategic plan, and this was a document that basically helped us outline a number of things, but really to help us kind of look from a beginning perspective of how this account's going to run, what we're going to do, what we want out of it, our objectives, management, even down to kind of the guidelines of how we're going to prepare tweets, retweet, and evaluate. Next slide. So one thing I wanted to point out really quickly is just an important part of Twitter and any type of social media platform is just the management aspect. So one thing to ask yourself in the beginning is who's going to be responsible for the daily activities, and if you're not there or someone's not there, who's the person that's going to back it up? Determining how many tweets per day or week you're going to do, who's going to monitor it regularly, looking for retweets, are people messaging you, what are people saying, are they asking questions, and for us, being a government agency, big thing was clearance. And so how are we going to use this timely and quick form of social media? How are we going to have our clearance process marry with that? So for us, one of the ways was to develop an editorial calendar, which can help expedite clearance and also help you plan content in advance. Next slide. So here's just an example of what our editorial calendar looks like. It's very low-key. It's in Excel. It's got the topic of the tweet. It's got the date proposed, date tweeted, the actual tweet itself, and then also the shortened URL. So this is a great tool that we use. I can send it to my supervisor. She clears the tweets in advance. And then I know Maureen's going to talk about Hootsuite, but this is also a way for you to then plug those tweets into a scheduler, and then you're not interfacing with the platform on a day-to-day basis. You can really just put them in and have them already pre-planned. Next slide. Another step would just be to develop content guidelines. For us, our content has to be in line with our goals and objectives. It has to contain specific information about hepatitis or related information, and mainly it needs to be accurate, timely, and relevant to our audience. We also looked at how to find content, so where are we getting our content from? And for us, it was really important to do some promotion of our resources. We do a lot around our publications and webinars and conferences, but we also can pull information from credible news sources and partner organizations as well. Next slide. This is just briefly showing you kind of the do's and don'ts of content on Twitter. I won't go over all of these, but this is just some things that I've learned to live by and really are helpful. So like I said, use a URL shortener, monitor the conversation, try to plug in where you can with different hashtags. Don't use more than 2 to 3 hashtags in each tweet because some people see that as spam. And don't use any abbreviations that people wouldn't know kind of off the top of their head. Next slide. Here's just some information on how to find content in the broader conversation. So like I said before, you can use Twitter almost as a search tool to kind of see what people are saying around a specific topic or event. Another way would be a lot of people are subscribed to Google Alerts. Having those where you get information about a specific topic, you can use those as Twitter content. You can provide links to articles or news events, etc. Next slide. One thing that we've learned here at CDC is that, and this is kind of across the board and even just the Twitter universe itself, is that using tweets that have any type of media, so images, pictures, video, anything like that, really do increase engagement. And so for us, we call that snackable content, and it really continues to be the most engaged content from our handle. So pictures from conferences, we post our materials on our Twitter. Next slide, you can see some examples. So here's some examples of our campaign creative, some infographics, and also just our video PSAs. But other ideas could be posting, conference events or health fairs. Any type of imagery is really a great tool to engage on Twitter. Next slide. Briefly, here's just some other social media applications that you can use with Twitter and other social media platforms. So Thunderclap is a really great tool. It's an amplification tool. You actually sign up and donate a tweet, Facebook post, or Tumblr post to the cause. And at a certain time, all of the tweets and posts are sent out at the same time so that users sort of create a wave of attention. So we did this last year on Hepatitis Testing Day, and it was really great. We got a lot of great feedback, and we actually kind of were a trending topic at one point. So it's a really great way to get your information out there. And then, as Kate said, and I know we're going to talk about later, just using Vine, 6-second videos. They're really fun, great way to entertain and have creative content on your feed. Next slide. And lastly, just join the conversation. Get on there and try to play around and see what's going on. Follow CDC, HEP, and other of our partners, and make sure that you use relevant hashtags. There's some there listed. Showcase your events, materials, resources with links and images, and definitely participate in the upcoming Hep B Unite social media contest. Next slide. And lastly, these are just some resources. I think these slides will be posted or recorded, so these are just helpful things that I've found to find the information on social media. Thank you.
Great, thanks so much, Amanda. And yes, we will definitely post all of these presentations after in about 7 days at the latest on our website, and we'll also send a follow-up email. So now we will, I'll turn it over to Thaddeus Fan, who will talk more about Hep-Free Hawaii's social media.
Great, thanks, Kate. Can you hear me?
Yep.
Okay, cool. So as you all can see, I'm going to talk a little bit about how we got started on social media at Hep-Free Hawaii. I think this presentation is very snackable, so there'll be a lot of visual stimulation for you all. I started with our handle on this page because I really just wanted to show that you can immediately start engaging on social media just by following Hep-Free Hawaii on Facebook, Twitter, Instagram, and YouTube. So we can already kind of start to engage. So next slide, please. My camera's not working today, so this is a picture of me. Hi, I'm Tedious Monkey. That's my handle on Instagram and social media. And I wanted to kind of show that, it's fairly easy. My background, no formal training. And next click, please. No prior experience. So really, I'm really good at identifying opportunities. And next one, click once, and building relationships. And I think this is what we have in common with a lot of the people who are probably on this call is with the limited resources around hepatitis B, we have always had to leverage opportunities and use our relationships and partnerships to really move things along. So even if you have no formal training or no prior experience like myself, you can do it. So click next, please. So you got this, right? So what are we going to do? So today, I was thinking about this, and I broke it down into these 4 steps because I really was trying to figure out how we do it here. So you as an agency, as an individual, as an organization, I think just start small. Don't feel overwhelmed by this vast, world that is social media and the Twitterverse and the Facebook and all that. So just start small. And then as Amanda said, just start planning, figuring out what you want to do, how you're going to measure it, what your content is going to be, and then just start the conversation. I think an important thing for me to realize and for Hep-Free Hawaii was that social media was an opportunity to build relationships. So as much as we're going to share information, we're also going to create partnerships and build and enhance the network of people who are interested in what we do and also share our resources and our information. So just start talking, start engaging with people and building those relationships. And I think that is probably the biggest lessons that we've learned in social media is that it's all about building those relationships. And then finally, when you're ready, you can start growing. So then you can start moving into all the social media platforms that you might not be aware of, or thinking about how you can start making videos or doing more engaged media content. But really, we can start small. So next slide, please. I know I can't hear you all, but I just wanted you to take a moment to identify these and ask yourself, how many of these can you name just by their icon? I think we have Facebook, of course, there's Twitter. I actually don't even know all of these. There's Meetup, which my friends are on. I think I see Blogspot. But there's a wealth of opportunities out there, and there's all these different ways of engaging on social media. So you don't have to engage in all of them, but just know that there's different ways of engagement, and you can select the one that works best for you and your organization. And next slide. And I think, starting small, you are probably already on a social media platform, or even if you're not, you know someone who is. So really think about how you engage with people, how you keep up with your relatives and friends, how do you get information. Most people are on Facebook, a lot of people on Twitter, but many of us as health professionals are probably also on LinkedIn, and that's a great way to kind of start that relationship building on social media. So just think about where you're already engaged and how you can use that experience and that infrastructure you already have there to kind of expand your reach. Next slide. How much time do we have? That's a question that I always get asked by my boss. How much time do you have to do this? I think this is really important also because sometimes we feel like we have to be on, if we're going to start a Facebook thing, we have to be on there all the time, which would be nice, but we don't always have time for that. So this is just something that I pulled from a social media talk that I went to, and it shows peaks in interactions. And if you see, it says, it's great to post on Twitter on Sunday at 10 p.m. Well, you might be asleep by then, you might be doing other things. So just realize that there's all different sorts of schedules that you can select, but just figuring out how much time you want to invest in social media will also determine how much of an output you'll get. So for example, for Hep Free Hawaii, we try to post on Facebook Monday, Wednesdays, and Fridays if we can, or if there's any trending or at the moment news update, we'll just post it. And we try to stay engaged on Twitter almost every day if possible. And then Instagram, we also try to do a Monday, Wednesday, Friday post. So if you're able to kind of have time to maybe work on social media 3 times a week, maybe for an hour on each of those days, you might be able to start your social media engagement, right? So just something to think about. How much time do you have? Next. This is really important, and Amanda touched on this as well because it kind of touches on purpose. Who are you as an organization is really important. So someone asked, we are, if you complete this statement, we are really good at ... So what is your organization really good at? What is the value of your organization, and what is the role in the community? I just put some stuff here that we try to do with Hep Free Hawaii. So we try to inform people, give up-to-date information on the latest recommendations, things like that. I know CDC and CDC's Twitter is really, really excellent for providing information. For example, just an hour ago, they posted something on Twitter about Hep B rising among young residents in non-urban counties of Kentucky, West Virginia, and Tennessee. And many of those were from injection drug use. So just learning about stuff as things are happening. I think many of us work in advocacy, working with legislators, trying to make systemic changes, so that could be your role. You can use social media to rally the cry and get people together to, for example, submit information to Medicare, which is receiving public comment on Hep B testing coverage. So you can advocate and rally the cause. And then also entertain. I think really important to remember that a lot of people who are on social media go on there to kind of look at cat videos or find out what's happening. So always have that element of entertainment or making things snackable is a really important part of what we're trying to do too. For those of you who have started following at Hep Free Hawaii on Instagram or Facebook, you can see that our tone is a little bit cheeky sometimes, and we try to kind of keep it a little bit lighter to engage folks and have them interested in what we're talking about. So next, please. So you're starting small, you kind of have some time for this. You might be on a social media platform that you are comfortable with. You know what your purpose is and what your role is. Perhaps you want to inform people about what's happening in your community, give them updates. So start planning. So you too can excel. I was just feeling very punny that day. So next slide. But we use Excel spreadsheets for our planning. So you can develop a content and strategic plan, but I think what really helped us is tracking our accounts. So even just starting by creating an Excel spreadsheet of all your social media accounts, putting the password, putting your login, and then putting the URL. I also recommend bookmarking the website of your Facebook or Twitter so that you can access it easily. This is just an example from Hep3 Hawaii, just some of the stuff that we have on there. But really keeping track of it is really important because then you kind of know what's happening. Something that someone also recommended to me is saving your handle. So even if you're not engaged on Twitter yet, you can always create a handle for your organization and have it ready so that when it comes time for you to expand into Twitter, you'll already have a handle that represents your organization before someone else takes it. So that's also an opportunity as well, and something simple you can start with. Next slide. So making goals is really important. So you're going to do all this effort for social media, but how do you know it's working? So again, this is an Excel spreadsheet, very simple. For those of you who are interested, I can even forward you our copy, and you can just borrow all the formulas. But basically, you can do something like, I want to increase followers on Twitter by 50% by the end of the year. And if you see at the top there, that's kind of our summary. So on April 28th is when we started really collecting information, and we started with, let's see, 315 Facebook followers, and currently we have 433. So we increased it by 37%. So these are great measurables. You can kind of see how you're doing, and it also helps with reporting and with sometimes funding. When you're doing grant applications, you can show that you have followership, you can show that you're making impact, and that you have people who are interested in what you're trying to say. So very simple. Next slide, please. So you have things in place, you have a plan, you're starting small. So I think this is the opportunity to use what you are probably already good at, which is building relationships and talking story, as we say in Hawaii. So again, remembering who are you, what is your intention when you're on social media. I think what Amanda mentioned about content strategy or content planning is important here. Are you going to be cheeky? Are you going to be the source for information? Are you going to be the social advocate? Who are you on social media? And be consistent with that. What's your voice? How are you going to talk about that? I think plays into that. And then what's your purpose? So if we look here, this is something that our student created. It's kind of blurry, but it says, "We heart volunteers. Mahalo to Mark Lynn, who is a volunteer, for posting this awesome infographic about hepatitis in Hawaii." So our tone is a little bit more informal. We like using hashtags. We use emoji, so it's more visual. So that's kind of the voice of Hep3 Hawaii. It's a little bit younger, a little bit, we try to make it a little bit more fun. So next slide. So what's your purpose? I think the next slide is really important. So this is what a lot of people come to Facebook for, right? To play games, to get on Farmville, next slide, or to look at kitty cats. So when we think about Facebook or social media, really think about who the audience is and why they are on social media. Next slide. And this is partially why Hep3 Hawaii has more snackable content and has cheeky tone, because we're really using our stories and our visual media to build relationships and get people interested, and getting them to stop and look at us. And through that, through these stories and visual media and videos, we're able to spread the message of testing and awareness around hepatitis. So maybe Trojan horse around a little bit, use those snackable ideas, snackable content, those visual fun things to get your point across, if that is what you're trying to do. And finally, these are just some of the tips that we've learned over I guess the year or two that we've started to engage in social media. So as Amanda mentioned, brevity is really important. Even when we're not posting on Twitter, we try to keep our content really, really short, or we'll link to something so we don't have to talk about it too much. So if you look on this little post here, we just said, mahalo Hawaii, thanks for following us in 2015, see you in 2016, and then some emojis and some hashtags thrown in. And then we have some responses from people who are following us. So we really just try to make it so that when people engage with us, they don't have to invest a lot of their time. Because usually if they're on social media, they might not be looking for a long paragraph to read. We use a lot of pictures. This was our best 9 pictures on Instagram in 2015, and you could see very visual, very colorful. We really leveraged the Hawaii angle and try to show why it's important that people in Hawaii care for our community. We use hashtags a lot. I know Amanda mentioned that too. And we use hashtags to also leverage or to gain followers from other places. So if you go on, for example, right now on Facebook, one of the trending topics is hepatitis C. So if you put hashtag hepatitis C, you will be linked with all the other hepatitis C hashtags that are currently being posted. And you are part of that larger conversation. So what we sometimes do with, for example, on this post, there's a hashtag 2015 Best 9, and that was trending at that time. So everyone who was talking about 2015 Best 9 would also see our post too. So looking and seeing what else is trending and seeing how you can integrate that into your message is an opportunity to spread your message even further. Trending I talked about, and then really we noticed over the time that we spend on social media is that stories have become really important to the people who follow us. So if you see most of the things, if it's not a Hawaii picture, involve people or stories that we are talking about. So really using those stories, which we already have and which we know that you as agencies, as organizations, have great stories to tell. So use those stories to build those relationships on social media and really try to follow other people who follow you, like things that they like, if they like your stuff, and really kind of show a little bit of the social media etiquette to show that you're engaged with their issue and their topic as well. Next slide. So once you get the hang of it, once you're talking stories, sharing stories, you're hashtagging, you're following, you're doing all this stuff, then you're ready to grow a little bit further. And we're still in the figuring it out phase 2 at Happy Hawaii, but looking at other social platforms. I just started Snapchat, which is really fun, but how do we use Snapchat? How do you use LinkedIn to engage people? How do you use all these different social media? I think having dedicated staff would be an awesome way to look at social media. Then you have someone who can really develop policies and content plans, strategic plans that really focus your message and ensure that your voice is consistent across all social media platforms. And then really, social media provides opportunities for further engagement. Like I said, I just saw on CDC's Twitter that Hep B is increasing on people who inject drugs in certain communities. Well, that really overlaps with the work that Hepatitis C is doing. And as I mentioned before, Hepatitis C is trending. So Hep B can really dovetail now into the work around Hepatitis C and drug user health. So how do we leverage that opportunity, in a timely manner? And next slide. So this is one of the things that we're growing with. We're just getting onto YouTube and posting YouTube videos. And I think if possible, Kate might be able to show the video. It's just a short video on a recent effort that we made to share our stories for hepatitis in Hawaii.
I play the ukulele, I play slacky guitar, and Hawaiian steel guitar. I haven't done much with it because I guess the illness actually took a big chunk out of my life that I wasn't very productive. How can you go on if you don't have a passion? You have to have some kind of passion, something that makes you want to get out of bed in the morning, something that gets you through the hard times. When things get really bad, sometimes you don't want to do anything. The one thing I always wanted to do, no matter how bad I felt, was music. It would give me energy. Music is just the rhythm of the universe, right?
And that's just an example of something that we're trying in the next year to leverage more, is YouTube and those video things. So these are all opportunities for you folks, I think, as you consider social media, what your strengths are, perhaps videographers or students who are in social media or media, and how you can create those stories for yourself and then share them online. Next slide. So I think these are relatively 4 easy steps that you can look at. Starting small, start planning, start engaging and using those skills that you already have in relationship building, and then start growing when you're ready. And in the end, you know, I do hope that you follow Hep Free Hawaii. You can also use your hashtag #TakeThatHepatitis, and you can also reach out to TDS Monkey if you need any more resources, or you can just always email me. But otherwise, thank you for your time today.
Great, thanks so much, Thaddeus. That was a really fun presentation, and you could definitely see your social media personality and styles of engagement from your perspective. And now we're going to speak with Maureen Comiskey, who's going to talk from her perspective and the social media strategies that she employs at the Hepatitis B Foundation.
Thanks,
so Maureen,
Kate.
I will give you the mouse. There you
go. Okay. Thank you. I have been in social media for HBF over the last 5 years, and it's amazing how it's grown over the last 5 years. Thaddeus and Amanda are tough act to follow, but I'll give it the perspective from the over 50 crowd. Anyway, looking at our social media outlets, HBF has a really robust Twitter and Facebook program, primarily for the Hepatitis B Foundation handle and page, but also for our Liver Cancer Connect program as well. Both the foundation page and the Twitter handle have a following of around 5,000. You can also find us on Instagram, YouTube, LinkedIn, and also on Periscope. And as Thaddeus was mentioning, it's a good idea to reserve a name on some of these outlets if you're not already active on them. Also, Hepatitis B Foundation has a very successful blog, which both supports our social media efforts and is promoted by our social media outlet. The foundation's audience might be a little bit different from some of you. It's quite a mix of partners in organizations, healthcare professionals, medical organizations, Hep B advocates, researchers. But due to our mission, our audience is really anyone living with or impacted by hepatitis B in some way. The prevalence for hepatitis B is very high in other parts of the world, so much of our following is international. Taking a look at our Twitter followers, you can see that really we're split 50-50. Half of them are US-based. The other half really are from all over the world. So that's somewhat unique. And looking at our Facebook followers, that's even a different audience where 85% of our following is really from other countries, with only 15% of them US-based. They really are predominantly those people living with or supporting someone with chronic hepatitis B, but they do include U.S. and international healthcare providers, viral hepatitis organizations and advocates from both the U.S. and all over the world. I would say that due to the stigma associated with hepatitis B, there's a reluctance sometimes to join in these very public forums, and I think that does keep our numbers down, which is it's certainly unfortunate. Content is certainly key due to the diversity of our followers and where they are in their hepatitis B journey. The content people are looking for really varies with the individual and where they're engaging with us, whether it's on Facebook or Twitter, because the audience is a little bit different. So I really try to create a mix of content, including hepatitis B related news and publications, journal articles, any kinds of announcements, and I'm looking for those daily. I'm looking for them through Google Alerts. I'm getting alerts from other people. I get things from Sherry or Joan from all over. So those are being posted daily, and then of course we're posting things that are highlighting Hepatitis B Foundation or Liver Cancer Connect resources, from our website, different publications, research. Also, we're going to create messages that have hepatitis B and liver cancer messages that both educate and raise awareness. And then, of course, we're happy to be promoting our own events and our partner events and activities, advocacy and policy events and efforts out in the, out there. Taking a look at our Twitter content, I wanted to give you some examples of our Twitter content. This is from the Hep B Summit this summer. I covered that live, but I often cover events remotely, like through Joan Block, sorry about that, or through or through Sherry Cohen or even Kate, who passed along information. I was up at 5:30 in the morning to post things from the World Hepatitis Summit. Some of the tweets highlight hepatitis B related stats and facts, educational messages, while others really are very newsworthy and provide links back to the Foundation website and other resources. So, taking a look at these examples from the Hep B Summit, World Hepatitis Summit, the WHO guidelines, so it's our resources, other people's resources. So the images really increase engagement, but you want to make sure you have a balance and there aren't too many images out there. Looking at our Facebook content, it's even more complicated and more varied because we like to touch on hepatitis B in different countries with both simple information for those that are just learning about their hepatitis B infection and more detailed hepatitis information for our regular followers that may be on their daily or once weekly to check out what's new with hepatitis B. So these are just some examples. We were happy to promote the accomplishment of Dr. Sue Wang receiving her award. This was a very popular post with our followers because they're always interested in drugs that are in development. So Joan Block was at HepDart. We wrote a blog. We promoted it. It was very popular, and it kind of gave the inside story of what's the latest and greatest in the pipeline for hepatitis B and for the race for the hepatitis B cure. And really our most popular post on Facebook was the big reveal of Bollywood star Amitabh Bachchan of his chronic hepatitis B infection. That really was that created quite a bit of engagement. So for Facebook, we're posting typically about 4 times a day, sometimes a little more, sometimes a little less. On Liver Cancer Connect, twice a day, even on the week, except for Liver Cancer Connect. We don't do that on the weekends, but we do for the Foundation's page. One thing to keep in mind with Facebook is that it really does require more monitoring because you have followers. Sometimes things can get out of hand if you're not keeping up with it, and they inbox you and ask questions. So it's a little bit more involved. Taking a look at, how do I manage this? As Amanda said, I really couldn't do this without Hootsuite. I really love the convenience of Hootsuite. I love the dashboard. I love the fact that I can see all my notifications. I can put up my Twitter lists on here. I can put up anything, any of my hashtags and put them up, which is perfect. And then I love the scheduling aspect of Hootsuite as well, that I can schedule and see it at a glance. Basically, this is my editorial calendar. Since I'm more or less setting it up myself, this is where I do it, and it's just simpler, and I can move them around, and that works out just fine. Looking at, I want to show you an example of using Hootsuite Mobile. I love Hootsuite Mobile app. You can put it on your tablet, your iPad, or any of your mobile devices. It's easy to install and use. Takes you from the dashboard all the way down through your list, through the details of a tweet. You can do everything from there that you can do, from your desktop, and you can compose tweets. One thing that I really like about it, it allows me to never be more than, I've always a mobile connection away from the Hepatitis B Foundation program, so it allows me to really keep in touch no matter where I am. I just wanted to give you an idea of how I might post from an event using the Hootsuite mobile app. It really simplifies the process. So I have it loaded on. Obviously, I've shared my photos, and all you would do then at this point is, if I took a picture, for example, at the event, I would share it with Hootsuite, and then I would choose which social network I needed to post it on, one or both. I could do them separately. And then I would actually compose my tweet, keeping in mind that my, you know, that I have, that the real estate might be limited, and then I can post it immediately, or I can schedule it off at a different time. So looking at the, just giving you an idea how we might prepare for an event at the Hepatitis B Foundation. Obviously, for an event or a campaign, you need the logistics, the dates, times, places, people are going to be there. What are your goals? Pick out a hashtag for the event, one that's easy to use, notable, but also short. Also, you're going to be posting live, or you'll be posting remotely. If you're posting live, is there Wi-Fi? If they have Wi-Fi, be prepared that it doesn't have the bandwidth to support your activities, and you're still going to be, you know, using your cellular plan. Your event planning, are you going to post 2 weeks in advance, like for a webinar where you start promoting it 2 weeks in advance, or do you need more time because people are traveling and they need to plan, or for a campaign where they need to do something, you might start, you know, months in advance and then, you know, zero in as the date approaches. And then there's your, you know, the actual agenda as you start to finalize the agenda, you know, for your event. It's really, it's a perfect time. I use the Apple Notes, and I actually put the name of the person and their title and whatever they're presenting that day, and I literally cut and paste from that and work it in and move it from there into Hootsuite, which gives me a really quick picture of the person. You know, I can take a picture and then put their information out there so that, you know, we know who's presenting, and it's right out there on Twitter or on Facebook. The only other thing I would mention is I post less to Facebook than on Twitter, and I might end up doing that later on in the post-event follow-up, where, you know, you do want to make sure you're exhausted after the event, but just make sure that you follow up, put all your photos into your up on Facebook, you know, create your albums. You don't have to necessarily put all your captions in, but at least get them up there. People are still excited. Make sure that you're monitoring the hashtag that you had for your event or for your campaign. You can thank people, follow up, send pictures, do a storify later. And of course, you know, at your final wrap up, you're going to want to make sure that you follow through with your promises. And finally, you know, I hope that you will join Hepatitis B Foundation. You know, join us on Facebook and on Twitter and our other outlets. Check us out daily. We have a lot of great information. I'm already doing the legwork, looking for the latest and greatest information. So please take advantage of it and share it on your page, or, you know, use it for Twitter, whatever you like. It's getting done, so you may as well take advantage of it. Please let me know if you have any questions. I'm happy to help out. Thank you.
Great, thanks so much, Maureen. And now, before we go into Q&A, I wanted to share a little bit more about the Vine video contest and how you can hashtag Happy Unite around hepatitis B this spring. So what exactly is it? So Vine to win. Use Vine to create, like I said, a 6-second video. That's the limit on Vine. And focusing on our theme, how you would unite for hepatitis B. And I wanted to show you a couple of examples from Hep Free Hawaii as well as the Hepatitis B Foundation team. So Thaddeus and his friend are using the hashtag Happy United here, and he used Boomerang to show the hashtag. And here is a message from our Hepatitis B Foundation team.
Get tested, get vaccinated, get treated, unite for Hep B.
So that was our 6-second videos. So, sorry, let me start from the slide here. So when do we start this campaign or contest? You can enter between April 11th through the 29th. So we'll close it on the 29th. And how you can participate, post your videos to Vine, Facebook, and or Twitter. All three would be great. And you must use the hashtag HepiUnite. And just to make it clear, it's hashtag HepiUnite, not our coalition name Happy United. And then tag at HepiUnited. We are on Facebook and on Twitter as well as Instagram. And then you must also email us your video if you'd like to enter the contest with your name and contact information to connect@happyunited.org. And our contest guidelines are now posted on our website. It's on our homepage at happyunited.org. And then you can also see them, click on the link here when we distribute the presentations. So I'm happy to answer any questions about the contest. And now we're going to go into a quick Q&A period. We have a couple of minutes to take your questions here. And just a reminder to feel free to submit them on the chat box. Okay, so we do have a question, and this is for Amanda. The question is this was mentioned on your liver chat slide. The question is, how do you measure the potential reach on Twitter?
So actually those metrics were pulled through a program called Sysomos, and it is a evaluation and metric tool that we actually pay to have. But you can also do some interesting things on Twitter itself. Twitter has free analytic tools that you can use, but there's an algorithm that I honestly I don't know the exact way they pull it, but it basically looks at out of the people that were in the chat and participated using the hashtag, it does a calculation based on their followers and then their followers. So it's some type of algorithm that Sysomos uses that I can try to look in and see exactly how they calculate it, but basically it's a number. It's sort of like media impressions, if you've ever heard that term. It's just a term that is used on Twitter to look at potential reach. So you have to kind of take it with a grain of salt.
Yeah, okay, thank you. And then we do have a question for Maureen. At Happy Foundation, this person wrote, do you have a budget for social media?
No, there's not a specific budget. It's certainly part of my salary, but
Right.
but it's split between the social media and outreach.
Yeah, and I can also add to this a little bit. I mean, if your question is as you're thinking about developing your organizational budget and budgeting for social media, what a lot of organizations I've seen do, and we at Happy United have also gotten the help through interns. So if you do have a very limited budget, which a lot of nonprofits do, that is one way to get some help, and it's a good experience, especially for folks that are in the public health communications field and want to get involved with organizations and nonprofit organizations. We do have a couple of interns helping us out this semester with our social media.
The only thing I will say is that everything we use is free.
Yes.
And that is a great thing to note, is most of the metric tools that you can use. Hootsuite has a metric system that they pull. Twitter has its own analytics. So a lot of the evaluation and metrics machines can be free. So that's a positive thing.
Great. And this question, I guess it's for anyone. How can one invite followers on Twitter? Is it the same as Facebook?
Well, you can mention them in a tweet. So basically a mention is putting their handle name, the @ and their handle name in your tweet, and you can say, hey, follow us on Twitter. You might be interested in what we have, things like that. So, or you can follow them, and sometimes just by following them, they'll follow you back.
Great.
That's how we built up our base, following people.
Yeah, that's what we did too.
And this question actually is a follow-up to the budget question, and the person clarified, there are ways that you pay to boost your posts, and they're asking if anyone does that.
We have done that.
We do everything free.
We have done that in the past. We had a promoted tweet campaign, and it was a very in relation to most tweet campaigns, like Coke spends millions of dollars, of course, or, you know, like a Hewlett Packard, but ours was a very kind of nominal fee. It was a substantial amount of money, but it wasn't in anywhere in relation to what normally people spend. And we did see really great metrics. I think one of our tweets in a 2-week span got over 500 retweets, and that was when we had released the new hepatitis C guidelines. And, you know, that's definitely information that I can share with anyone if they're interested. But I don't think that's necessary, just because it is kind of, in order to see a return, you do have to put a substantial amount of money in. So.
Hi, and this is Thaddeus. I just wanted to add to that, you know, there is, unless you do something to really alienate your followers or something, generally your social media following just tends to increase as long as you know, are consistent and continue to engage. So if you don't mind like a slower growth, your following will grow over time.
And I would just note too that, you know, number of followers isn't really always that important. I think if you really look at sort of the engagement rate, if you're having people engage with your tweets, click on them, Twitter has an actual engagement rate number you can look at that looks in how many people are following or even you know, expanded the tweet. So, I mean, I think those are numbers that you should definitely focus more on, the number of followers, because that really means that the content you're putting out there is worth someone engaging in, and you're reaching that audience and providing them with what they want. So that to us is kind of a more important thing than even just number of followers.
Right. Great. And then we do have one final question, and it's a good one for everyone. If you could just think about this, and it's for everyone. They said, thanks for the presentations. What efforts do you have to broaden your reach? Sometimes it feels like Happy social media efforts sort of stay within a particular circle, so meaning followers and medical professionals, other public health organizations, the public health community, etc. So any ideas, strategies employed, advice that you have that you've noticed caught the eye of new followers or new communities? So, Thaddeus, do you want to start?
Yeah, sure. So last year we did this mini campaign contest, and what we did is we engaged with local providers and shopkeepers who had huge social media following. And what we did is we asked if they could give gift certificates or some kind of prize, and they promoted it on their social media stuff too. And by that, I think we were able to increase our Instagram by over like 150%. Just by engaging with that already had a huge following. That was really, and it was free. We just asked for a couple of gift certificates, so that was really helpful.
Great, thanks. And Amanda?
Well, I think one way that we've done it in the past is sort of when I was talking about searching hashtags and relevant conversations. So, for instance, we wanted to reach out more to providers, but we didn't really know how they were using Twitter or what they were doing. So doing searches on, you know, technical terms, or even looking at, you know, AAFP or different provider organizations and kind of reaching out to them, either direct messaging them or mentioning them in tweets, just things like that to try to kind of get a better look at what they're looking for. And then once we knew what they were looking for, we were able to kind of provide more information on serology trainings or things like that. And that really did increase the engagement with, you know, specifically that population and ours.
Great. Great. And Maureen?
Yeah, I would just say that, you know, you try different strategies, mix up the content a little bit. You know, as I was mentioning with ours, we have such a varied audience. I mean, you know, some of the people living with Hep B are certainly not interested in some of the things that the docs are interested in, but sometimes they are. So you just mix it up, and when I see what, you know, gains the most engagement, then that's what I try to stick with when I'm able to.
Great. Well, thanks so much. I think we're going to go ahead and wrap up, and thanks to everyone who stuck around. I really enjoyed everyone's presentations today. I thought it was really insightful. Hopefully they were able to help you think of strategies as you either starting your social media efforts or looking to expand your work. And please do join us on our social media awareness contest, and enter the contest and join us in a Hep B awareness month we're going to showcase them during the month of May. So we'll choose final entries, and then we'll there are prizes, and those are outlined in our guidelines, so check them out. And here is ways that you can connect with us on social media. So like I mentioned, we're on Facebook, Twitter, and Instagram, and YouTube as well. Subscribe to us on YouTube. We'll be posting a copy of this presentation today on our YouTube page within the next week or so, and we will also send everyone a message with a copies of the presentation so you have them handy. So lastly, I would like to thank our panelists, Thaddeus, Maureen, and Amanda. Thank you so much for participating and for your time. And thank you, everyone. And finally, look out for a message right after this, and please help us continue to improve and give us ideas for our next training sessions via a short webinar. Thanks, everyone. Have a great rest of the day.
Thank you.
Thank you.
Thank you.